Hello, my name is Larry Williams and welcome to Health Matters. Today our focus is going to be on the Nebraska Office of Health Disparities and Health Equity. And my special guest is Josie Rodriguez. Welcome.
Thanks, Larry.
You know, I always like to start our program off by at least you telling us a little bit about yourself, about your career, and how we landed where we're at today.
Okay, sounds good. Well, I am a native Nebraskan, so born in Kearney, Nebraska. I started with the state of Nebraska back in 1992. So I've been with the state quite a while. Actually have worked in various divisions of the state. So I've done some Medicaid and food stamp eligibility. I worked in protection and safety, so that's with parents and families on reunifying their children. I've also worked in minority health previous to my role as administrator with the office. So I worked in the 3rd Congressional District office, which was in Lexington, Nebraska.
Okay.
I was a health program manager there, and so helped with the programs out in that area. And then I transferred with the Attorney General's office, so I worked there for about 4 years working in consumer protection and working with consumers across the state on how to protect themselves from frauds and scams. Worked a lot with seniors. And then I came to this position. I really had a passion for working with minorities and in health, and it was just a good time to move into this position. So I'm back with Health and Human Services. It's within the Division of Public Health, and they're at the Office of Health Disparities and Health Equity.
Okay. And how long have you been at that position?
I started September of 2011.
Okay.
So
Alrighty
a couple
then.
years now.
Okay. Well, tell us a little bit about the Office of Health Disparities and Health Equity. What's the mission, core function?
First, I want to say that it was previously called the Office of Minority Health, so sometimes people know it better by that name.
Sure.
But really what we do is that we improve health outcomes for racial and ethnic minorities, minority populations in Nebraska. That's our main focus. We do a lot with health disparities, and we know health disparities can be broad. You know, that could also include people in the rural area, it could include women, it could include men, it could include people with disabilities, but really the focus of our office is to work with racial and ethnic minority populations and improve their health.
Okay. Talk a little bit about your strategic plan. I think it goes from 2013 to 2017.
It does.
Maybe you can kind of just give us an overview of what's in that strategic plan.
Okay, when I came to the office, the strategic plan hadn't been in place yet, so we thought it would be important to really develop a strategic plan to guide us on where we want to go. And so right now it is from 2013 to 2017, and we focus on a lot of things like promoting chronic disease prevention, reduction of obesity. We look a lot, focus on maternal child health activities, and we also look at providing TA to the tribes, enhancing awareness of the disparities that are out there. That's a huge piece of what we do, because a lot of times people, first they don't know what disparities are. Then we have to tell them what the definition, I should say, of what a disparity is. Then we need to tell them what those disparities are within our population. The other part of what we do is really to write reports and tell people where the health status of racial and ethnic minorities are, and then provide technical assistance to other organizations that work with racial and ethnic minority populations. Another big thing that we do is we provide cultural competency, or we like to call it cultural intelligence, presentations across the state to organizations that are interested in it.
Okay. Let's talk a little bit about cultural intelligence, okay? When I was, reviewing the website and talking to you prior, I kind of wanted to know some of the specific programs that you do, and specifically, let's talk about what a lot of people call cultural competency, but I kind of like the cultural intelligence name that you've given to that broad and general area.
Yeah, well, we have a curriculum that we created in about 2012. And it was called cultural competency, but we thought cultural intelligence was just a little nicer name. Oftentimes people, when you hear cultural competency, you think, oh, I've already gone through that, and so I am culturally competent, I'm done. And we thought cultural intelligence just put a different spin on it. You know, right now there's a lot of businesses that hire people that have cultural intelligence. It's kind of like your IQ, but a little bit different, because you're talking about your ability to work with different types of people from different perspectives and backgrounds. And so that's why we titled it that, excuse me. What we look at, Larry, is that we don't really, in our training, we don't tell people this is how you work with African Americans or Native Americans or Hispanic or Asians, but we really focus more on This is different communication styles that people have. You need to look at the perspectives and the background that somebody come from, the things that they've gone throughout their life, because that really frames their thought process and the way that they communicate with other individuals. So we kind of look at communication styles. We look at like power distance, how people react to different people's power. We really focus on perception. We do also in our training have a big chapter that's chapter 2 on history. Because history, you know, what happened in the past really shapes the future, as we all know. And there's so many things that have happened in the past for many racial and ethnic minorities and could affect why they do some things now. And so we thought that history was a huge piece of that, and so that's a big chapter in our curriculum. And like I said, we have a chapter that focuses on communication. We have a chapter that focuses on stereotypes and generalizations. So it's a very interesting training.
And I think sometimes people forget how history for ethnic and racial minorities just sort of, I don't want to say patterns, but it just sort of envelops how they may react.
Exactly.
Not only in the work environment, but in the health field, or just what I would say normal everyday interactions with people. So, and maybe you can talk a little bit about that, because I think some folks underestimate how important that is, or can be.
Oh, definitely. You know, there's a lot of things that have happened in the past. You know, the Tuskegee experiments. There's a lot of, I think there's just a CDC, I think, just sent information about a event they're going to have throughout the country. They kind of bring something to different cities, showing the Latino culture and what they have gone through in the past and how that affects their future. Even the tribal population. You know, there's so many things that have happened with the tribes and the government, and you know why they might be leery about doing some things with governments. And so we know that that is so important. And so, you know, a lot of times racial and ethnic minorities, they don't have high numbers in like when they're trying to test a drug or something. And it could be because of some of those things that have happened in the past. And so it's so important to really be able to communicate with, you know, it doesn't matter what population you're talking about, just individuals, and build those relationships with them to figure out, you know, how we can improve those health outcomes. Another thing that we focus on our training is the stereotypes, as I said, but also the social determinants of health. There's a lot of things that come into play when you are looking at health outcomes for people. It's not just about them making good choices, but there's so many different factors that come into play. And on another show that I was on, we talked about how the environment has so much to do with one's health as well. You know, where you live, where you grew up, maybe where you work, all those things can have an effect on your health. And so we talk about that in our training as well.
Okay. Let's talk a little bit about the Minority Health Initiative, okay? Maybe you can explain to our audience what that program is all about, that initiative is all about.
Yeah, one of the big things that our office does, Larry, and I'm glad you brought that up, is that we oversee funding, and it's called the Minority Health Initiative funding, and it began back in about 2002 or 2001 when the tobacco settlement was awarded to the state. One of the things that Nebraska did was, in addition to helping establish local health departments across the state, they provided funding, minority health funding. And that funding goes to the office, and we distribute it to counties that have 5% or more minority population. The funding stays the same, but unfortunately, the population keeps growing. And so that's one of the difficulties that we have, is using the same amount of money to serve more people. But the focus of those is there's certain focus areas like cancer, diabetes, cardiovascular disease, infant mortality, and asthma that these organizations have to focus on. And they do have to apply for the money, and they're 2-year funding cycles. But as long as they focus on those areas, they can apply for funding, and they're awarded 2-year grants.
Okay, and maybe I know you don't know all the specifics, but maybe you can talk a little bit about some of the things that those organizations would do in the communities.
Yes, a lot of them do screenings. They do health education. A lot of them focus on diabetes and lowering the hemoglobin A1/3 levels within individuals. Some of them do health-based assessments just to try to get individuals to, better health. Some of them focus on medical homes, trying to find individuals in medical homes and working through community-based agencies as referrals to getting those individuals to medical homes. So they do a variety of things for us. Our office actually provides a report each year on that, what those grants and those organizations have done.
Okay, basically what the outcomes have
Exactly.
been from
Exactly.
the provision of the money that you have provided.
That's right. That's right.
To those various organizations.
Yes.
Well, let's bring it a little bit home here. We've got about 4 minutes. Let's talk about the Lincoln-Lancaster County project.
Okay.
Maybe you can tell us a little bit about that.
Yeah, the Lincoln-Lancaster County Initiative, they get roughly about $800,000, and that is to serve quite a few minorities in Lancaster County. They are one of the projects that do focus on medical home. So they try to find individuals of medical home, and they work with, the nice thing about Lincoln-Lancaster's project is they have done something that's really nice, is that they have kind of used an approach to bring a lot of different partners together and using the community organizations that serve those racial and ethnic minorities. So they work with El Centro, Malone Center, the Asian Center. I know they've worked with before the Indian Center here in Lincoln, and just have really been able to use those organizations to help serve minorities, to either as a referral or helping them with health education programs. I know that the community-based organizations also put on a lot of health fairs to get some of that information out. So it's very nice, a good program.
Okay. I seem to kind of get the impression that possibly it's one of those model type programs because of the collaborative nature of it. Is that fair to say?
It is fair to say. In looking at, the last 2 years that I've been here, it's been interesting to look at that compared to others. It is nice because they are taking a different approach and using those organizations that the racial and ethnic minorities go to often, and really collaborating with them to try to get better health outcomes.
Okay, all righty. Well, that's the first half of our program. We're going to take a short break, and we will be right back to talk more about the Office of Health Disparities and Health Equities with Josie Rodriguez.
Today is Saturday. Salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your toes Tuesday. Let's move Monday, swap us next Sunday.
60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
Welcome back to Health Matters. My name is Larry Williams, and our special guest today is Josie Rodriguez with the Nebraska Office of Health Disparities and Health Equity. I know you have quite a few events coming up, and maybe you can generally talk about it and where folks can find out more information about the type of events, the type of trainings that you offer that people would be interested in going to.
All right.
Or attending.
We have some events coming up about cultural intelligence, our training. Now, our cultural intelligence training is roughly about 2.5 days, Larry, but we can chunk it down into different chapters for organizations. So I would say that any organization that is interested in us coming and speaking, they can contact our office. We do have some events that are coming up, and people can go to our website to look at when those events are coming up. And our website is www.dhhs.ne.gov/health disparities.
Okay, all righty. And again, folks can go to the website and see what is available, what's coming up, and give your office a call if they need more information.
Yes, that is right. Some of the other things that we are doing with our maternal child health monies is that we try to also involve the community in helping us achieve better health outcomes. So one of the things that our office focuses on is community health workers, or we like to call them lay health ambassadors. And what those individuals do is that we train them on specific health topics, then they go out and provide these health presentations to community members that they know, or organizations that they go to. So we will have some trainings coming up on those specific topics, and like I said, they're on maternal child health or on diabetes, cardiovascular disease, so different health topics. If anybody is interested in helping us do that, they can go to our website as well and contact us, and we can sure get them on that list.
Okay, so you provide them the training, and then they become lay ambassadors to spread information, disseminate information about health issues and concerns.
That's right.
Okay, and they can give your office a call or check it on the website.
That's right.
Let's kind of talk about the governance of the office. I think you have a council or a board that provides oversight. Is
Yes.
that fair? Maybe you can talk a little bit about that.
Yes, our office does have a Minority Health Council, and they provide advice to our office just on our strategic plan, some of our goals and objectives that we're doing within our specific funding. Just help us guide the office. And so we can have up to 25 members. We do usually meet here in Lincoln. So anybody that would be interested, has a passion for minority health, or is just interested in becoming involved, they can send their resume to our office, and they are appointed by the medical director of the Department of Health and Human Services. And so once they're appointed, then they can come to the meetings.
Sure. Are these monthly, quarterly, or how are the meetings?
Quarterly meetings.
Quarterly
We have
meeting.
quarterly meetings.
Okay.
And we do cover travel, any travel or mileage expenses as well.
But by and large, most of the meetings have been here, held in Lincoln.
That is correct.
And again, this is a statewide board, so you have members from all over the state bringing their perspective and views on issues related to health disparities and health inequities.
That is exactly right. We have individuals from Lincoln, we have individuals from Omaha, Grand Island, Scotts Bluff. So we want a variety of individuals on our council so that we do have those various perspectives.
And I'm going to probably guess that this is a very diverse group of individuals.
Yes, it is. Yes.
Okay, that's a good thing. We've kind of skirted the issue, but maybe we can take some time now and just generally talk about some of the health disparities that you see in all of the research, the work, the consultation that you've done with the various organizations throughout the state. And I'm just going to kind of let you take that and share with our audience, what are you seeing?
Well, first let me first define health disparities, because oftentimes people aren't really sure what we mean by that. And so really it's just a difference in health and health outcomes among different populations. And so some of the big things that we are seeing among our racial and ethnic minority populations is diabetes rates are very high, especially among Hispanic and Native American populations. We also have cancer that is really the number one, unfortunately, killer among pretty much among all populations. Heart disease is another one that is up there. And as you know, diabetes and heart disease are very interrelated. So with our minority health initiatives, they tried to focus on things that can help with both of those conditions. Unintentional injury we see is pretty high among Hispanic and Asian and Native American, as well as African American too.
Can I butt in here for a second?
Yes.
Unintentional injuries?
Yeah,
I'm not sure what you mean by that.
So we'll be talking about like car crashes and things like that. We at the state level, they do a lot with safety belts. And so really teaching parents the importance of car seats, putting kids in car seats. Oftentimes, unfortunately, people don't wear their seatbelts. And so really trying to help people understand the importance of wearing your seatbelt and putting your kids in a seatbelt is important. But there's also other things related to that. It could be violence, and the consequences of that violence.
Sure.
Okay. But really, with the Native American population, diabetes is another killer among that population. So there's those main ones. Heart disease, like I said, cancer, stroke, diabetes, and unintentional injuries are way up there with our racial and ethnic minority population. So we really try to develop, we do behavior risk factor surveillance surveys. And so those are surveys that if you get a call from an organization saying they're helping the state collect health information, please do it, because that's how we collect our information. We write reports based on that, and that's what these reports are telling us. But the disparities, of course, the causes of death, which I'm talking about, are based on the death data.
Okay.
So we try to really look at programs that will help us reduce these health disparities.
Okay, and just to make sure, we're making these comparisons between our minority population and any other populations? Is that what we're comparing?
The white non-Hispanic population.
Populations.
Yes.
And so,
yes.
so all of those things that you listed, there seems to be a difference, or at least a higher rate of incident with our racial and ethnic minorities.
That's
okay?
right. That's right.
We didn't talk about this beforehand, and so if I catch you off guard, that's okay. Any differences between racial and ethnic minorities when it comes to male and female?
Yes, there are. Yes, there are differences in those populations as well. Cancer's always up there for women, for men as well. But yes, there are differences in those. I don't have those specific ones
Sure.
here, but they're pretty much in the same area. Heart disease, cancer, diabetes, they're pretty much all within those three diseases.
Okay. You know, one of the things I think is always so very, very important for us to do and to share with our listeners, because we're talking about tax dollars, we're talking about state funding,
Yes.
also talking about grants from the federal government. And I think sometimes people wonder, well, why do we need that? What's the purpose? You know, maybe you can share with our audience, you know, what you feel, what the board or the council also feels, and obviously the Department of Health and Human Services, what they feel are the importance of having your office on board, and why is that important to the state of Nebraska?
You know, clear back when the office was created, there was one report that they had created, and that was just, they were saying that there was a huge disparity among, health disparity among racial and ethnic minorities and the white non-Hispanic population. And so they were seeing that need. And as the population, the minority population in Nebraska has grown and continues to grow, Larry, as we know, it just continues to grow exponentially. We need to everybody have better health. We know that if somebody within our community doesn't have good health and they're not able to access that health, then they would be going to the emergency room, and that affects us all. So the health of one person does affect the health of everyone, which is why it's so important for the services that we provide and the programs that we oversee to have those programs, because as like I said, if our minority population right now, we have a younger minority population compared to the white non-Hispanic, and so those individuals are going to get older and older and older, and if they have worse health, it's going to be worse health outcomes for all of us. So by doing these preventative types of things, then that will help our general health improve for everybody overall. And our office works with many programs. One of the big things that we do is partnerships. Without partnerships, we couldn't do a lot of what we do. Just like the Lincoln Lancaster program, they have developed partnerships with those community-based organizations. We have developed partners with university systems, our internal chronic disease programs, to help us, how can we improve these health outcomes? What evidence-based programs are out there that'll help us achieve these results? And so our office works with so many different partners internally and externally. And if we weren't there, I think it'd be hard for a lot of those organizations and partners to reach these racial and ethnic minority populations. So, and one really good thing I think is this community health worker or like health ambassador program that we have, is that we've been able to establish those relationships with community members to help us get that information out there, which I think is vital. I know that they've been around, community health workers have been around for a long time, and they're coming back slowly. But a lot of times people want to listen and take information from somebody that looks like them a little bit easier maybe than from the TV or the news or
Correct.
anyone else. And so I think that by having our office help provide those services, it is so important for the overall health of the, Nebraska and the nation.
In the nation, yeah. I think one of the other things that while you were talking that came to mind here is the real importance of having the knowledge is power, power is knowledge.
Yes.
And if we didn't know these disparities exist, I think we're not progressing toward a society where health, everyone is healthy, or everyone can be.
That's exactly right.
Because you're providing information so that people can strategize and figure out how we can combat and make sure that there is less disparities between the races.
That's right. So with us providing information on what the health disparities are. We provide reports out to the community, to the state, to help people get funding. You know, there's not a lot of other organizations out there that are compiling reports based on the health information about racial and ethnic minority populations. Without those, there's a lot of organizations that wouldn't be able to get funding based on that. So we provide that, but then we also go and provide programs to individuals, and then we provide the cultural intelligence training to organizations so that they can provide better services to those individuals. So we do quite a lot of things that I think is very important to the state of Nebraska and important to where we're going to be in the future.
And again, it brings up another point that I think that our audience and our listeners need to know is that, you know, in order to apply for funding from grants or foundations, you need to be able to justify or show what the need is.
That's exactly
and if
right.
you cannot show that need, the chances of you getting funding are nil, and so many of the organizations don't have the capacity to actually do all the research and the compilation of the data that you, as a statewide organization, can provide not only to the state,
Right.
but to everybody else within the community that is concerned with health.
That's right. That's exactly right.
Okay. Well, is there anything else that you would like to add? We've about run out of time here, but I want to make sure that if there's anything else that you'd want to talk about or share with the audience, this is your chance right
That's
now.
right. You know, I just want to let people know that our office does quite a few things, not only the cultural intelligence training that we want people to, if they're interested, please call our office. You know, we do the community health worker, the lay health ambassador training for community members, but we also focus on obesity. Obesity is, you know, growing among everybody, unfortunately, especially within the racial and ethnic minority population. So we do have a program, it's called Catch Kids, and it's an obesity prevention program. But any organization that is interested in doing that program, our office actually purchased kits and they can check them out from our office. It's a 6-week program. We really want to try to get that program out. So anybody that's interested, come to our website. We have a lot of information on our website that people can access.
Okay. Josie, thanks so much for being here today.
Thank you, Larry.
Thanks for sharing all this information with our audience. And again, our focus today has been on the Nebraska Office of Health Disparities and Health Equity. I hope that you learned something today. And again, for more information, please check out their website or give their office a call. Again, my name is Larry Williams. This has been Health Matters, and we will see you next time.